Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us, yet again, Dr. Aditya Agrawal. Dr. Agrawal was our first uh, guest doctor on the health webinar series, and he's here with us once again. The topic that he's going to deal with is busting the myths of COVID care. For those of you who are meeting him for the first time, he's a leading consulting pulmonologist attached to several large hospitals in Mumbai. Bhatia Hospital, the Bombay Hospital, of course, the Parsi General Hospital, and Wockhardt in Mumbai. He is extensively trained in respiratory diseases both in India and New York. His special interests are difficult to treat cough, asthma, bronchitis, and lung fibrosis. He's a dedicated researcher and a peer influencer in the management of respiratory diseases. And most importantly, he is a friend of Seniors Today. He's here with us, I think, for the third time, and he has written a few times for the magazine. And it's always a pleasure to have you with us, Dr. Agrawal.
Thank you. Thank you so much to have me back again. And I think today I'm going to speak on the topic I thoroughly love, which is speaking about COVID and trying to bust the myths which are surrounding the management of COVID. There's so much negativity being spread about COVID right now. And I don't think I ever switch on my television just because of the scare of having to undergo the trauma of listening to those TV anchors.
But while what you're saying is correct, there's so much of negativity around in the media, but there's also negativity on the ground. For instance, it's so much of negative stuff happening. People are going crazy about oxygen cylinders. May not be as much in Mumbai right now, but up north in Delhi, etc. It's really very bad.
I know how it feels. Okay. I am consulting about 30 to 35 new patients in Delhi every day. And when I'm treating those patients, I can hear the wailing family members in the background when they are short of oxygen, or, when the general condition of the patient is so poor. It's true. But then a lot of it is also because the patients and the residents don't realize that you can make do with little. You can actually make do with little. You don't need fancy stuff, you don't need a hospital, you don't need multiple cylinders or multiple concentrators. The fear has gotten the worst of everyone right now.
I agree that there is a fair amount of fear. I'm going to ask you an unfair question. You've been on our show a couple of times. You've been in the thick of things, so to say, in Mumbai and the rest of the country since the time when COVID came in. If you need to look at comparing what we are in today vis-a-vis what we were there uh, last year, and if assuming that last year was a score of 5, where would you place the situation currently? 0 being the lesser side and 10 being the higher side.
I don't think I would like to compare the situation then and now. uh, I compare myself from then and now. At that point of time, I was also fearful. I was also learning. I was in in the process of learning several new things, and which I am even now. But I'm definitely much more confident about what I'm doing today. I know I don't have to rely upon too many resources. I don't need a patient to be in a hospital, even if he is dropping oxygen, unless it's a very low number. I know I can treat those patients if the patients are doing the adequate things at home. Um, a lot of admissions last year were out of fear and out of lack of knowledge, which is not happening anymore. Now, when I am admitting somebody to a hospital, it is only when he needs the infrastructure of a hospital. Otherwise, I treat that patient at home. As compared, when you compare last year and now, what's changed is last year the numbers were limited. This year the numbers have increased manifold, because it's not just a single person from a family who's infected now. It is entire families. I've seen when it started off, I did have a lot of families in last April and May, but then by say when the first wave started in July, August, September, October, in those months we are seeing individuals, not the entire families. But this time around, something has changed. The double mutant virus, or we don't know much about these mutants right now. But these mutants have definitely been much more virulent. Yes. So the other thing is we can treat it. We can treat it by just simple observation. You don't need many medicines also for treating this disease. It is just like any viral disease you've seen in the past. And if we treat it with disdain, you can beat COVID.
Right? Treating the disease with disdain. Doctor, we have, as the topic suggests, we are going to break the the various the bust the various myths that are there. And so the first bit that you have busted is the fact that you don't need to really get worried about COVID. Uh, there are known remedies for it. Uh, the question which we have received is uh, that, doctor, what is the scene with vaccines? Despite the fact that a friend of ours has taken two shots, both the shots, he has still contracted COVID. Is it helpful or is it not?
Vaccines are extremely important. Uh, I'll give you a simple example. I'll just explain it in terms of other ways. You have a room of 10 people. You have given the vaccine to two persons amongst the 10. The amongst the other 8, two have the one has the infection. He passes on the infection to the other 8. Now, these 8 also transmit the virus to the two who have taken the vaccine. So the chances of somebody getting the vaccine and then getting infected is about 40%. That means because the efficacy of the vaccines is about 60% when spaced 4 to 6 weeks apart, what happens here is the chances of them getting the infection is 2 out of 5. So amongst the two who have taken the vaccine, one of them may get the infection. Okay, and this could be the person who your friend is. Now, if you have in the same room vaccinated 8 people, you'll have 2 persons left unvaccinated. The chance of the two amongst the two having the infection is fairly low. Obviously, the ones who have been vaccinated would not have the infection. Okay, so once you reach, this is called herd immunity. So what happens is once you reach a level of herd immunity, the propagation of infection will stop. Now what is happening is we have only selectively vaccinated the population. We have vaccinated less than 1% of our population, if I'm not mistaken, right now. Once we reach the magic numbers, that's about 60, 70, 80%. That's when we will see complete stop of the propagation of the coronavirus infection, the COVID virus infection.
And that is perhaps going to take at least a year from now.
No, not really. I mean, with the way the government is investing monies, the way private sector is investing money, I don't think that day is very far when we all would be vaccinated. A lot of politics have been made around COVID vaccine right now, and I think we should all rather start encouraging the people who are doing their job well instead of criticizing the government and criticizing um, the vaccine makers. We would rather be helping them in boosting up their manufacturing capabilities. Every time we speak about costs, we are actually disincentivizing them into investing more money to manufacture more vaccines, to make bigger plants. Everything costs money. What we want is we want the cheapest, but we want it at a time when we want it. That doesn't work.
Right. And tell me, we are aware of the fact that the new Russian virus is going to be coming to the country
The
now.
vaccine.
Yeah, the vaccine. Now, do you think it's a good idea to wait for it, or go ahead with what is there right now?
You take any vaccine that you can get hands on. If it's the Covaxin, the Covishield, or the Sputnik, when it does come in, you take it. If you get a vaccine tomorrow, do not shy away from taking one. Do not wait for the next best one coming your way. because when you um, take the vaccine, you form a part of the bigger vaccinated pool. You need to increase the pool. If you keep waiting, so will the person next to you, and so on and so forth. And ultimately, we will delay our vaccination, will delay vaccinating the entire country.
Doctor, we have a question that has come in from an anonymous attendee. Uh, is this entire thing about the medication that is required for if you do have if you have tested positive? So the question is, doctor, I have tested positive. I have a count of 26, and I'm staying at home and taking the treatment. But what is the ideal treatment? Because the doctor whom I've spoken with has said that you just take paracetamol and take eggs and do some gargling and stuff like that. Do I need to take any special medicine, or is it just fine to take basic medicines?
So I definitely cannot answer specifics on your case right now, but I can speak about management in a broader perspective. COVID COVID infection is a viral infection. You treat the COVID infection like any other viral infection, where you treat it symptomatically. If you have fever, you treat the fever with paracetamol. You keep yourself cool. You take cold water showers. You drink cold water to keep your body temperature low. You do not have hot water and burn yourself. You do not wrap yourself in blankets and keep your body warmer or make yourself warmer when you have fever. The mistakes which we are making. Everybody wants to drink those concoctions of multiple spices and burn their throat, or people are constantly gargling with hot water and burning their throat and adding to one more symptom. So there's a very simple saying which I have built over the years: a pill for a ill and a pill for a pill. That means for every symptom, you're giving one pill, and for every pill to prevent its side effects, you're giving another pill. Our prescriptions are running into 15 to 20 medicines a day. We need to stop that polypharmacy. How do you treat COVID? You watch. You count from the day you first had fever. Oxygen usually does not drop before the seventh or the eighth day, if it ever will. So you have the time frame. What is happening is our patients are um, ignoring their symptom of fever. Even a fever of 99 for 5 minutes on a given day counts as something which you should investigate for a possible COVID virus infection. Today, any fever that a person has should be screened under the lens of COVID infection. If you do that, you will never miss a COVID infection. Now, there are certain times when a doctor's expertise comes into play. I have had patients who have had fever, have tested negative the next day, but because my clinical suspicion is so high, I retest them on the second day and the third day and the fourth day, and they have tested positive by then. I don't go rush for CT scans. The CT scans have no meaning, especially in the current scenario when everybody is demanding of me for a CT scan. I'm taking two steps back. It does not help me change the treatment of my patient. Now, when you talk about drugs such as doxycycline, ivermectin, azithromycin, and whatever else you have heard of, really have not proven to be effective in the large clinical trials which are being conducted all across the world. Um, Now, things which have really helped us are remdesivir, steroids, and anticoagulants as the blood thinners. Now, remdesivir has now the reason why remdesivir is not finding as much traction across the world is because the US FDA determines the need for a medicine only if it reduces mortality, only if it prevents death of a patient. But what remdesivir should be used for is its antiviral properties. When used early, appropriately, it prevents severe disease. Okay, if we can manage to prevent severe disease, the drug has done its job well. But then in America, a person would not be reimbursed by his insurance company if that were the criteria. Then steroids. This use of steroids, the steroids have again been misused rather, like they have always been. The correct use of steroids is eluding us. There are certain places in the country where steroids are given upfront on day one of illness or day two of illness, which is wrong. You're actually adding fuel to fire. The minute you give steroids in the first 7 days of the infection, you end up flaring up the viral infection, you end up flaring up the viremia, that is the spread of the virus through the body. It has to be used appropriately only in patients who have low oxygen. And when do you use anticoagulants or blood thinners? So, what you and me know about blood thinners as a layman is that aspirin is a blood thinner. That's because your cardiologist has always given you one when you have a heart disease or you've heard about it. But the anticoagulants that we use are the ones which prevent venous clots in the veins from forming. Aspirin just prevents aggregation or clumping of platelets in the small arteries which supply blood to the heart. Okay. So there are different types of anticoagulants or blood thinners. So do not ask a doctor for aspirin when you don't need one, because aspirin does nothing in the management of COVID. Now, yes.
Yeah. Doctor, a question that we've received is that clearly oxygen levels going down is where things could get a little serious. How do you ensure that oxygen levels don't go down?
So ideally, we try to preempt, it's our clinical judgment, our clinical knowledge, and our experience which teaches us how to judge which patient's oxygen levels will fall. There are several methods to that. And when you are consulting your doctor, when he's conversing with you, he would ask you several questions. He would look at your lab results and probably a chest x-ray if ever the need be, to determine if your oxygen levels will fall at some point of time. uh, a saturation of oxygen saturation of 97% is normal, but 96% is abnormal. So when somebody's oxygen levels start falling from 97 to 96 to 95 to 94, you have sufficient time. It doesn't go from 97 to 90% or 80% all of a sudden. So most patients who have dropping oxygen have been rather callous in their approach or have not been consulting the right person. Uh, so how do you? So come back again, Pradyuman. What do you
How
want
do
to
you
ask
ensure
about?
that your oxygen levels don't go down?
So there's nothing much that you can do about your oxygen levels going down. They would definitely go down. So you have to stem the fall. You have to, buttress the fall. How do you do that? When the oxygen levels indeed start falling, you need to introduce steroids. Need to introduce blood thinners, the anticoagulants. Now, what would you use? One over the other or both? Would be best decided by a doctor looking at various parameters. You cannot at random, have a rubber stamp prescription where you have the same set of medicines for every patient. Do you wear tailored clothes or ready made clothes? Obviously, tailored, right? So you have to have tailored prescriptions for each patient. You cannot one patient's prescription cannot be given to another.
Right. So the question that is there is there a way in, I have not, even if I have not tested positive, is there a way in which I can ensure that my oxygen levels will never go down?
I mean, that's something. If you don't have the COVID infection, why should your oxygen levels go down? Okay. Now, if you indeed don't have the infection and your oxygen levels are going down, there are several other diseases other than COVID where your oxygen levels may go down. It could be the heart, it could be the lung, or both, which are causing your oxygen levels to go down. Uh, Very often with pneumonia, your oxygen levels can go down. With bad asthma, bad bronchitis, or interstitial lung disease, your oxygen levels may go down. So, just broadly speaking, low oxygen levels do not mean COVID infection, except for now.
Uh, Doctor, we have a question from an anonymous attendee who says a senior citizen with comorbidity has taken the first dose of vaccine and was still infected with early stage ILD detected. Should they still go for a second dose of the vaccination and the duration gap between the dosage?
So if you have had the infection after the first dose of the vaccine, you count you count 6 weeks from the day when you first had the symptom when you take the next dose of the vaccine. Do not take the vaccine from the day when you had the vaccine, the first dose.
All right. Uh, we have a question from Mr. Nagaraj. Two questions. The first one is, why do we have so many cases today? Can you please explain about home quarantine and discipline? When a first vaccinated senior gets positive after recovery, when should he take a second jab? Which is you answered, but the first one, could you explain about home quarantine and what is the kind of discipline that is required?
So what's happening is today, after the first wave, we had become complacent. We had stopped maintaining social distancing. Our pubs were full, our temples were full, our churches were full, our um, shopping malls were full of people. We went back to living normally, though we didn't realize that we were still in the midst of the pandemic. And we were aware that we are going to face challenges even later because we had not been vaccinated by then. Uh, and because of this overcrowding and because of the large congregations of people, we've had this second wave. It's the new mutant is extremely virulent. So you cannot save yourself from from the virus if you don't maintain the adequate social distancing and masking procedures. Now, as for the second, what are the principles of home quarantine? Home quarantine means that you stay put inside your room without contact with another human being. Okay. And when you do so, you should ensure that you do not spread your respiratory particles to members in the family who live in the same home but in a different room. You should not have them you should not expect them to wash your clothes or do your dishes, because there you may spread the virus to them. um yeah. So the other parts of home quarantine would include you maintaining a proper social distancing, wearing a mask while you're in the common areas, which you should avoid again. While you're in home quarantine, you should be in constant consultation with your doctor. Ensure that he is prescribing you adequate medicines and the needed medicines and nothing more. Yeah.
Uh, Doctor, is double masking the right? Is it really needed, or is just a plain surgical mask? Would that be okay when one is there in the home?
When somebody is in the home, I think the double two-ply surgical mask should be sufficient. When somebody is going out, he may want to wear a N95 mask.
But you mentioned about at the home. That's only when you have somebody who's not from the home, right?
Yes,
Who's come from outside. For instance, you may have your domestic help or whatever.
yes, absolutely.
The other question is that, Doctor, last year when we had the first wave of the virus, we would look at disinfecting everything. Is that still required? Because there was a news item where it was mentioned that surfaces are not really affected.
I think that still holds true. That disinfectants are not required as much now, but you would still want to be careful about not touching your face, your respiratory epithelium, your eyes after you have touched a surface which may have respiratory droplets from a person who has an infection. So, frequent hand washing, masking are extremely important, not just for the person who has the infection, but for even somebody who may have come in contact with one.
Uh, Doctor, the only interaction which I have with the outside world is when I give my kachra to the person in the morning, or when I have the home delivery folks who come in. Is there any special precaution I should take when I'm taking deliveries or when I'm giving away my waste bag?
I mean, when you're giving up the waste bag, obviously there is not much physical contact. But when you are accepting deliveries from somebody from outside, you don't know the how clean the person's hands or gloves were while he was delivering the goods to you. So after you've accepted your delivery, you may want to transfer the contents of the delivery into another space. So if it's food, you pour it into a plate and microwave your food once again. If not for only 30 seconds, and you dispose of the containers from the outside and wash your hands before you touch your food.
Uh, Doctor, we have a question from Suresh Kamath who asks, due to shortage of vaccine, if I don't get the second dose within the stipulated time, say 8 weeks or 60 days, what will be my status?
Uh, so whether you have the first dose, if whether you have had the second dose or not, it is immaterial. You will still maintain your social distancing and the safe practices. Uh, you're lucky if you don't receive the vaccine in the first 6 weeks, and because when you space your vaccines by 12 weeks, the research says that with Covishield the efficacy increases to 78%. So you are expecting an additional 15% efficacy by just spacing your vaccines 12 weeks apart.
So, Doctor, I must ask you this question. I've spoken to, since we have doctors coming in every week, I've asked this question to a few people and I'm a little confused. I took my first dose in early April, 4th April to be precise. So, and the Coven dashboard said it's due May 2nd, although when I took the vaccine, it said 6 weeks. So when should I actually take? Should I actually wait for 12 weeks or should I take it immediately?
So there are a lot of fears that they may deregister you of the vaccine program. Um, I have no idea, and I don't think I'll be the right person to comment upon that. But you delay it for as long as possible, and if you delay it by up to 12 weeks, you actually ensure better efficacy. So you have time until the 4th of July to get the vaccine.
Okay. Uh, we have a question from Mr. Sushil Kumar, who's 73. He says, I took the second dose on the 28th, but got infected on 2nd May. What benefit do I expect due to the vaccination?
So when somebody has had the two doses of the vaccine, it is only 2 weeks after the second dose when the full effect of the vaccine comes into play. You would still have only about 50% efficacy, which is afforded, or rather 30% efficacy, which is afforded by the single dose of the vaccine. So when that happens, what will happen is you will have a less severe infection than others. You may not require ICU admission. Okay. So you basically are looking at a less severe form of the disease than somebody who has not been vaccinated.
Right. Um, this is an anonymous attendee who asks, will a rapid antigen test, if negative, does it rule out COVID?
No, a negative rapid antigen test does not rule out COVID. A rapid antigen test which is positive indicates that you have the infection. But if the rapid antigen is negative, you would want to do the RT-PCR to be a little more sure that you don't have the infection. But then to complicate matters further, the sensitivity of the RT-PCR is about 70%. So that means 2 out of every 3 persons who have the infection may turn out to be negative on the RT-PCR. So again, the clinical skills, the clinical knowledge of your doctor is paramount here. We are going back to those days when what the doctor said was true, and the tests are becoming a little less significant right now, but they are only meant to supplement a doctor's diagnosis.
Uh, Doctor, the question from Mr. Mahalingam is, if someone has shown symptoms, and this is something that you said, if someone has shown symptoms, has tested negative due to the presence of an infected person at home, despite the person's isolation, is he or she considered to be positive, irrespective of the negative report?
The prerogative is on the patient, on the person who's showing symptoms, to retest himself, and that on the doctor. So the doctor he's consulting should advise him to retest himself, because retesting may show up the infection. And there are some patients who continuously turn out to be negative, and when you go back and take a detailed history, you realize that the patient has probably passed his infectious period and is now in the inflammatory phase of the disease, or way past his window a period when he was most liable or most likely to have dropped oxygen. So such patients are also being commonly seen in our practice today. So I'll give you a simple example. You have somebody in the family who's tested positive. The person A is tested positive on 1st of May. You expect his oxygen levels to drop by 7th or 8th of May. You have person B who has been asymptomatic or believes has been asymptomatic until the 5th of May. Okay, that's the usual window period when the patient is since exposure to infection. Now this person turns symptomatic on the 5th of May with simple symptoms such as a dry cough or little fever or a niggle in the throat. Now this person will and he tests negative repeatedly. But this person who had the symptoms on 5th of May may have had a few symptoms in the last week of April, or may have had the infection the last week of April but was barely perceiving his symptoms. Such a person comes to us on the 10th of May and says, I have tested negative 5 times in a row. Do you think I may have the infection? And you go back and take a history that he first had symptoms on the 20th of April. How do you manage such a patient? So you tell this patient that you probably had the infection in the past, you do not have an active infection, you do nothing except treat yourself symptomatically.
Right. Uh, Thank you. We have a question from Mr. Raghavendra Odia, who says, I've tested positive on April 2. It was a mild version, had fever for 2 days. Based on online consultation, I took medicines recommended by my doctor. This was followed by with some blood tests which were normal. After 14 days of quarantine, I took an RT-PCR test, which was negative. My doctor suggested a CT scan in May first week. Is it necessary to get a CT scan? I'm completely fit. And Mr. Raghavendra is 74 years old.
That's a difficult question to answer. Extremely difficult, because I don't know what you would achieve by getting a CT scan now, or in the even during an active disease. I don't. There's precious little that you can gauge from a CT scan unless it's a severe disease. Uh, so in that case, getting a repeat CT scan may not really be that helpful. But then again, you have to check with your local doctor why he needs a CT scan, or what he would change after seeing the CT scan, or what will there be additional medicine, or would there be additional tests required if the scan did show up something.
Right. We have a question from Mr. Malcolm Montero, who says, my brother-in-law has just tested COVID positive and is in home isolation. Could we have contact details of doctors to consult for professional COVID home isolation treatment? Could he perhaps contact you, or is your clinic for help?
Yeah, absolutely. I am consulting about 40-45 patients every day online from all across the country, actually, not just Bombay, where I'm based. And at the peak of the pandemic, I was treating about 120 patients in the hospital, the four hospitals that I visit. Um, they could contact my secretary at the Opera House Clinic. That's 79772 66729. That's my secretary, Mrs. Slesha,
Sorry,
or
I just repeat 79772 66729.
that's Mrs. Slesha Pawar, my secretary,
Yeah.
or my clinic number is 2366
One
double
second.
four.
One second. So 79772 66729 is your secretary, Mrs. Pawar, and your clinic is
2366 4455, and my personal number is 9022163859.
9022163859. Sorry, no,
9022163859.
59. Okay. So I'm going to put all these numbers on the chat window right now. So you all have it. Uh, but doctor, how do you manage with so many patients a day? 40 to
I'm
100?
just I'm just driven. I'm just driven. There's so much that you can do. And this is the only time when people are crying out for help. If you can't do your two bits now, leaving behind your comfort, you'll never be a good human being.
Amazing, and more power to you, doctor. And hope you continue with the way it is. We have a couple of more questions which have come in. Um, these are very basic questions once again. Mr. Raghavendra asks, can we safely handle our daily newspaper? Any precautions necessary?
I think these are all questions which came, were discussed last year when the pandemic just started. Handling surfaces, newspapers. I think you're good to use one if you think that the person is not infected or it's not contaminated by the virus.
And the question from Katie Dadanji, who's a regular at our events, uh, is doctor, is it okay to take part-time servants in the house since the second wave is more virulent? What precautions should we take when they come home?
The stuff which comes into your home is a human. Any human contact is a potential source of infection. You could infect them, they could infect you. It could work both ways. At this point of time, avoiding human contact is the best way out until we all get vaccinated. Uh, if you can make do without domestic staff, it would really help.
And I guess she has the question that she's asking is perhaps she's not able to make do. So, what kind of precautions should one take?
So ensure that the you and the staff are both masked. Ensure both are wearing mask. Ensure that you clean surfaces, or he or she cleans surfaces, and constantly wash hands with soap and water if they are sneezing or coughing or have. And you also need to be honest to each other, uh, i- that if you ever have symptoms, you tell the other person to not come into the close pair.
And these masks that you wear when the domestic help is there, is it an N95 or a surgical mask?
A surgical mask should suffice.
Um, we have a question from Mr. M.K. Mukherjee. In the present situation, after a gap of 7 days from taking the second dose of the vaccine, if someone has to fly from Bangalore to Delhi, is it okay? The person is of uh, is just 30 years old.
I mean, when you've taken only the first dose, you barely, and within the first 15 days, you barely have any efficacy of the vaccine showing up. You wouldn't have developed sufficient antibodies to prevent the infection or to prevent a very severe infection. Um, if you have to fly, you have to fly. If you can avoid flying, that's the best thing to do.
Uh, Doctor, there's a question which said that you just said that it's best to wait for 12 weeks for the second jab. Now, and you also said that the efficacy is best after 2 weeks of the second jab. So, isn't it better that one takes the vaccine after 6 weeks or even earlier so that the total efficacy is good sooner?
No, it doesn't work that way. The efficacy of the vaccine works better when you have taken the two doses of the vaccine 12 weeks apart, and the best efficacy is achieved 2 weeks after the second dose.
So 12 plus 2 weeks.
Yes.
We have a question from an anonymous attendee who says, I'm a gynac. Me and my husband had COVID on 19th April without much complications. Both our vaccines are done 2 months back. Are there any chances of getting reinfected again? Can we start practicing medicine again?
I think everybody should go back, all the doctors should go back to, to practice now. The fear of getting the infection will always remain. Um, so after two doses of vaccine and 2 weeks after the second dose of vaccine, the chances of you getting a new infection or a very severe infection becomes a little less. So the efficacy of the vaccines when taken 6 weeks apart is about 70%. So 2 out of 3 persons who have been exposed to the virus will be protected, but 1 out of the 3 may get the infection. And yeah, so if somebody does indeed get the infection would usually be very mild, but you have still seen exceptions. You still maintain the same social distancing, or you maintain the same level of PPE which you did while examining patients before you got the vaccine.
Uh, Doctor, we have two questions which are similar. One is from Mr. Sham Prakash Agarwal, who says, what precautions need to be taken while using lifts or one needs to avoid? The second one is, should one be using the lift or should one be using the staircase? Because the staircase means exposure to more people who may have come out from their homes, but the lift is an enclosed cabin.
So if you want to, I have two ways to it. You want to get healthier, use the staircase. Uh, Elevators are actually enclosed boxes where the circulation of air is restricted. You may want to avoid elevators if you are very scared about contracting the infection.
Right. Uh, Doctor, we have a question from Mr. Nagaraj, and this is a question which I guess a whole lot of people also are asking, that we are in the second wave. How serious is going to be the third wave?
I am not a Nostradamus. We don't know what's going to happen. We don't know what is the state of the vaccination. What if we are all vaccinated before the start of the third wave and we won't have one? Let's look at the positive sides of it. By the time the third wave comes on, we will have better infrastructure. We would have greater knowledge. Your doctors would be more informed. The public at large would be better informed, and we will still continue our meetings on seniors today.
Well, just for this, I hope I don't have to call you for this. I hope I have to call you for some other ailments and afflictions. But seriously, I hats off to a doctor like yourself and the various doctors who we have. You're examining so many patients from across the country, and clearly this is where one needs people like yourself for doing the kind of work that you all are doing. And the kind of questions that we received and the questions that we received in the past does indicate that there is a fair amount of ignorance that still exists despite the webinars that we've been conducting for the last 1 year. There are still questions that we've received. There are still some questions which are fairly basic in nature, like you mentioned that some of these questions were also asked last year, but that exists as we hear stories of losing you know near and dear ones, people's friends, relatives, etc. This is really sad news. So hats off to you, and my salute to the entire medical fraternity, and I'm sure all the others who are here join me in doing that.
You know what? I need to make one comment here. If we just get our act together, if we just stop being ignorant about medical science and improve our quality of general medical education, we can do a world of good to ourselves. Today, the Indian public by large has very poor general medical knowledge. They perceive every fever to be something inconsequential. They do not want to be tested. They are still walking around, even with a fever, in the common spaces and public spaces, which should stop. When we look at the Southeast Asian countries, anybody with a flu is taught how to wear a mask. A person with flu will always be found with a mask in a Southeast Asian country or in countries like Japan. We don't uh, we have people spitting and sneezing all over the place in the public spaces, on the streets, in the malls, in the cinema, everywhere. If we can just stop and make some behavioral changes, we can do a world of good. The other thing is, Indians are very um, skeptical of doctors, or they may have a general mistrust of doctors, and that problem is that evolves into them self-medicating, or seeking consultation with five different doctors at the same time for the same person, and in the process they complicate matters. You can save lives by not asking for unnecessary medications, unnecessary steroids, and also you need to ensure that somebody who's getting hospitalized fits the criteria for hospitalization. So we have seen very often that patients lie about their symptoms before they are admitted. A doctor somehow trusts everybody who comes to him. So if somebody tells us that his oxygen is low, we will assume it is low. It's difficult to actually tell that the patient did not have a low oxygen at that point in time, and we admit such a patient. So don't allow your fear to decide or help a doctor make his decisions. Let the doctor take independent, strong decisions.
Uh, we have a question from Nandini Podar. I'll just sign off with that. But since she's asked, and I think these are important things to know, should one keep an oximeter at home? That's the question. Is that something that you would recommend that one keeps at home?
Yes, having an oximeter at home is not a bad idea, but oximeters are now running out of stock. So you may want to be careful about that. Have one oximeter with you, or you could just have one oximeter between several families in a building complex. Uh, you should always remember that oxygen does not fall all of a sudden. So suppose if you have had fever, you have a 7-day period before your oxygen levels will fall, if they ever will. So count the days. Ensure that you report your first fever. If you don't do that, if somebody is failing to do that, he's actually failing himself.
So what you recommend is actually a good thermometer that one must have at home more than the oximeter. And if one has an oximeter, you don't need to check your oxygen levels 3 times a day.
I mean, it depends, if you've had the fever, if you know you have the COVID infection, or your doctor tells you have the COVID infection, he'll give you instructions to check your oxygen and how often you would need to do that. So suppose somebody is on day one of his illness, I wouldn't tell the patient to check his oxygen 3 times a day or 4 times a day. I'll ask him to check his oxygen a couple of times a day, and that too is inconsequential because I know his oxygen will not fall with the outset of the first fever.
But on a normal day, for instance, a day like today when one doesn't have the any symptom, any fever, you don't need to really check your oxygen.
Did you ever do that before the COVID?
I didn't, but after that I do.
That answers your question, right? You're as fearful as anybody else.
Yeah.
And that's where the medical knowledge comes in. The
As if
general medical knowledge.
learning is a dangerous thing, and clearly, that's where the problem is these days. Great. Thanks a lot once again, Dr. Agrawal. I know you have a super busy day. You possibly work 50 hours a day. And for taking this time out, we are very grateful and much obliged. Thank you very much once again.
Thank you.
And as I said, I hope we have you again, but we don't have you for COVID. We have you for, other issues concerning pulmonology. Thank you very much.
Thank you.